Doctor, the patient had bronchogenic aspects? Well, if by bronchogenic you mean originating in the bronchi, yes, I do. Suppose, doctor, it was originating in the nerves of the bronchi. Well, if it were originating in the nerves of the bronchi, it would be bronchogenic. Otherwise, it is neurogenic. And what is osteogenic? Osteogenic is originating in the bones. As well as pathogenic. Pathogenic means disease producing. In this case, there was a breaking down of red blood cells in the patient? Yes, there was. What we call hemolysis. Hemolysis, yes, a breaking down of red blood cells. What about myolysis? Myolysis is something completely different. It is the destruction of muscular tissue. And a breaking down or disintegration of nerve tissue is called what? That is neurolysis. Neurolysis and not pathogenic? It is pathogenic of nerves. Doctor, what is a fibroid? A fibroid is a tumor of the fibrous tissue resembling fibers. And lipoid? Lipoid is fat-like. And lymphoid? Lymphoid is resembling lymph. What is anisocytosis? Anisocytosis means inequality of the size of the cells. And the increase in the size is called what? That is lymphocytosis, which is an excess of lymph cells. Now, what is leukopenia? Leukopenia, as I state in my medical report, is abnormal decrease of the leukocytes in the blood. What is neutropenia? Neutropenia is an abnormal decrease of the neutrophils in the blood. Doctor, so what are the different cells in the blood? Well, there are eosinophils and leukocytes and other neutrophils. Doctor, what is the chirospasm? The chirospasm is a spasm of contraction of the hand, otherwise called writer's cramp. And writer's cramp is what? It is chirospasm. What is involuntary spasm? That is a spasm or contraction of the muscles which occurs without control over it. And that is an involuntary contraction? Yes, an involuntary contraction or dactylospasm. Doctor, what is dactylospasm? Dactylospasm is a spasm or cramp in the fingers or toes. What is an enterospasm? An enterospasm is a painful intestinal contraction. Doctor, let me ask you about the root stem or main body of a word which indicates the organ or part which is modified by a prefix or suffix or both. Yes, properly, Greek combining forms or roots should be used only with Greek prefixes and suffixes, Latin with Latin, Greek with Greek. In reality, there are many inconsistencies in the forming of words of medical terminology. And a vowel, doctor? A vowel, usually A, I, or O, is often inserted between the combining forms for euphony. And by euphony, you mean what? Well, I mean it's sounding good. And what is adenectomy? Adenectomy is the excision of a gland. And adenoma? Adenoma is the glandular tumor. What is adenocarcinoma? That is a malignant tumor of a glandular epithelium. And what does it mean, doctor, when you say aerated? Well, aerated means air, that it is filled with air. And what is aerobic? Aerobic pertains to organisms which live only in the presence of air. Is that an aeroneurosis? No, an aeroneurosis refers to a functional nervous disorder affecting aeroplane flyers. And that is a diseased condition? Yes, it is. What is angiotomy? Angiotomy is the dissection of blood vessels. Angitis or angeitis, that is inflammation of the blood vessels or lymphatics. What is arthralgia? Arthralgia is pain in the joints. And arthritis, an inflammation of the joints. Arthrology, Arthrology is the science of the joints. What is blepharedema? Blepharo or blephar edema is the science of the swelling of the eyelids. And blepharoplasty is a plastic operation upon the eyelid. And blepharoptosis is the dropping of the upper eyelid. Doctor, you mentioned the cardiac, yes, pertaining to the heart or esophageal orifice of the stomach. And what is electrocardiogram? An electrocardiogram is a graphic record of the heart beat by an electrometer. An electrometer? That is correct. What is the pertinence to the brain? That would be called cerebral. And cerebromalacia is the softening of the brain. The cerebrospinal is what? That is referring to the brain and spinal cord. What is a cephalad? A cephalad means toward the head. Cephalic pertains to the head. Cephalitis is inflammation of the brain. Cervical, pertaining to the neck. Cervectomy is an excision of the neck of the uterus. And cervicovesicle is relating to the cervix, uteri, and bladder. What is chylitis? Chylitis is inflammation of the lip. Chyle means lip. How's that?
It's good.
All right.
Chylitis.
Cheilitis. Chyle, Cheil, is a form which means, term which means lip. You can read it?
Blepharoplasty. Oh,
Yeah.
yeah, I got it. Doctor, the patient had bronchiogenic.
No, bronchogenic.
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 Aspects present. Answer yes. Which by bronchogenic you mean originating in the bronchi? Answer yes, I do. Doctor, it was originating in the nerves, the
How do I originate?
bronchi. First stroke is I wrote original ORJ. So I wrote ORJ and Nate
Right.
question. Well, if it were originating in the nerves of the bronchi, it would be bronchogenic. Otherwise, it is neurogenic. Question, what is osteogenic? Answer, osteogenic, originating in the bones. Question, as well as pathogenic. Answer, pathogenic means disease producing. Question, in this case, there was a breaking down of red blood cells in the patient. Answer, yes, there was. What we call hemolysis?
Yeah.
Answer, hemolysis. Question, yes, a breaking I'm sorry, this is the answer, yes. A breaking down of red blood cells. Question, what is myologist?
Myolysis.
Myolysis. Answer, something completely different in the destruction of muscular tissue. Question, a breaking down or disintegration of nerve tissue is called what? Answer. That is called neurolysis. Question. Neurolysis is not pathogenic. Answer, it is pathogenic of nerves. Question, doctor, what is a fibroid? Answer, it is a tumor of fibrous tissue resembling fibers. Question, and hiploid?
Lipoid.
Lipoid.
See, lip, L-I-P, means fat in Latin. So an oid means like. So lipoid, the word means like fat.
Yeah, but the next sentence is lipoid is fat-like. Question, and lymphoid? Answer, lymphoid is resembling lymph. Question, what is ansocytosis?
Aniso. Aniso is a prefix in Latin. It means unequal.
How do you spell this?
A-N-I-S-O.
Question is,
So anisocytosis, cyte is C-Y-T, is and osis means a condition of. So it's a condition of unequal cells. Anisocytosis.
I forgot to turn off the